Hey, so in this video, we're gonna continue our cataract case. We're starting with the examination. If you have not seen the history taking of cataract, please do visit our channel and watch the history taking of cataract case and then continue with this video. So in examination of a cataract patient, we first look at the general features. So we see if the patient is conscious, coherent and cooperative and well oriented to place and time. And then we talk about built and nourishment, if the patient is moderately built or heavily built, and if he or she is well nourished. Then to the general examination, as in any general medicine case sheet, the pickle, that is the pallor, icterus, clubbing, cyanosis, lymphadenopathy and edema. We look for all these features, and then we note the pulse, heart rate, respiratory rate and temperature of the patient. Then moving on to the ocular examination, the most important. So in ocular examination, I'm going to explain this in a series of tables. So the first thing is visual acuity. As we have said, the chief complaint is diminution of vision. So visual acuity is something that measures this diminution of vision. So how do we measure this visual acuity? So we basically can do it by counting. We ask the patient to count fingers from different distances. So here, for example, I've mentioned 3 meters. So that means the patient is able to count fingers from 3 meters. So we actually start from 6 meters and then move close to the face. If the patient is not able to count the fingers, then we ask them to identify hand movements. If not that, then we ask them to, if they're able to perceive light, right? So even based on ocular exam, that is visual acuity, we can differentiate types of cataract. So we have immature, mature and hypermature cataract. So if it is immature cataract, that means the patient can be able to count fingers from 6 meters to face, then we can decide it's an immature cataract. If it's a mature cataract, the patient won't be able to count fingers, but he can perceive hand movements and light and even projection of rays. But if it's hypermature, that is advanced cataract, then only the patient can there's only perception of light. So this is how we can differentiate types of cataract based on visual acuity. Moving on to the next, we also see the adnexo of the eyes, eyebrows, eyelashes, eyelids, orbits, eyeball, palpebral aperture, bulbar conjunctiva. So why do we check all of this? So this is to rule out if any ocular infections are present, stye, conjunctivitis. So this is to rule out if everything's normal, so that during surgery other ocular infections don't spread into the eye, right? So that's why we check the conjunctiva, farnesial conjunctiva, and the limbus, sclera. So again, corneal size and shape. So we know that the eye's refractive surfaces are cornea and lens. So diminution of, and cornea and lens are the ones which project rays onto the retina, and this via the optic nerve reaches the visual sensory area. So any defect in these three structures, that's the cornea, lens and retina, lead to diminution of vision. So it's important that we check all of them to see the diminution of vision, because there's no point, see, if there's damage to cornea and you're operating the lens for cataract, and still the diminution of vision will persist because the damage is to the cornea or retina. So we need to cross check everything. So we see for corneal examination, we check the corneal size. So this is the normal measurement of the cornea. Then corneal shape, and then corneal surfaces. So corneal surface, we check all this to rule out if there are any corneal disorders present, like dystrophies, corneal degenerations. In dystrophies, we have pterygium, pingecula, all of that. And then we also check the corneal transparency if there are any opacities, nebula, adherent leucoma, all of that. And then we check for corneal sensations, and then anterior chamber depth. We also check about anterior chamber contents by slit lamp examination. And then we move on to iris color, iris pattern, again to see if everything's normal. And then lens position is to be noted, because in some types of advanced cataract the lens can be sunken and displaced, so all of that, so we need to check the lens position and the shape of the lens. Then transparency of lens is again a very diagnostic feature of cataract. So here, for example, I've written grayish white opacity. So based on opacity's color also you can differentiate cataract. So in opacities, if it's grayish white with an iris shadow, that means it's an immature cataract, right? If it has a pearly white opacity, it's a mature cataract, and if it's milky white opacity, it's hypomature cataract. So what is iris shadow? So iris shadow is again a very important diagnostic feature. So here in this picture, I've labeled this blue arrow mark, this black thing is the iris shadow, and it is only seen in immature cataract where there is partial opacification of the lens, and when the light is projected, so it focuses on the opaque structure. So, and iris shadow is only seen in immature cataract, and that is important to note. It's a diagnostic feature. And then we check extraocular movements if it is full in all directions, intraocular pressure if it's normal or not. This is to rule out, this we do by tonometry. It's to rule out ocular hypertension or glaucoma. That is also surgery related. So we need everything to be normal before surgery, everything in place. And then lacrimal apparatus regurgitation test. So it's negative here, like usually. This is to rule out chronic dacrocystitis, again to prevent infection while surgery, like external infection into the eye. So now we're done with examination and moving on to provisional diagnosis. So this is basically summing up your whole case sheet. You should mention personal details, chief complaints, past history, like important past history, and any positive examination findings that are diagnostic. So here's an example of how you need to present the provisional diagnosis. So here we have a 63-year-old female patient named Sita came to the OP with a chief complaint of gradual painless loss of vision from the past 1 year. So if you have any other positive presenting complaints along with gradual painless, like glare or photophobia, anything, so you can mention along with this. And then she's a known hypertensive and diabetic for the past 10 years and is on regular treatment. This is important that everything's under control. And on examination, there's markedly reduced visual acuity, that is, say, able to count fingers from 3 meters or anything that you get in the examination. And with grayish white opacity of the lens with an iris shadow is present, right? So this is the diagnosis, and from the above observation it suggests that the patient has unilateral or bilateral, immature, mature or hypermature, that you can come from the diagnostic features, senile or congenital cataract. So this is your conclusion. So after the whole presentation, you will be definitely questioned on what would your treatment modality be. So cataract treatment is always surgical. So if there's any other like preconditions, like any infections, you first treat that. After everything's normal, or everything, BP and diabetes, hypertension and diabetes, everything's under control, all systemic examination is done, everything's normal, and then we proceed to the surgery. Our surgical treatment is extracapsular lens extraction with posterior chamber IOL implantation, that is intraocular lens implantation. So we can discuss treatment and theory of cataract in depth in further videos. So if you like the video, please do like, share and subscribe, and see you there.